Hello and welcome, everybody. You may see me a little bit blurry. I apologize. I don't know. Sometimes the internet acts out in a weird way. I'm Gustavo Tolosa, and today I'm welcoming two of my most favorite doctors, Dr. McDougall and Dr. Clapper. And this is going to be a great interview, and everybody will receive a replay later on today. How are you doing, Dr. McDougall?
Hey, I'm doing really good, and I'm very excited to have one of my longtime friends. I would say of all the things I would think about our next guest is he's a doctor who sees patients, takes care of them, addresses their problems in some very conservative ways. Our next guest speaks and practices similar to the way I do. He's got some different ideas, some things that I think you'll find refreshing. I'd like to introduce to you Dr. Michael Clapper. What kind of medicine did you do until you arrived at True North?
You and I have a common acquaintance, Dr. Alan Goldhammer, and I met Dr. Goldhammer 25, 30 years ago, and he was a young man then, and he says, well, Michael, someday you're going to work on the staff at my clinic. And I said, sure, Alan, and went off for the next 20 years and did my own thing. But I realized that nutritional medicine really is something I wanted to practice full time. And I had done 3 years of urgent care work in New Zealand and came back from New Zealand and was looking for a job. And I realized Dr. Goldhammer still made me that offer. So I joined the staff at True North Health Center in Santa Rosa, California, about an hour north of San Francisco in 2009. And for the next 8 years, practiced nutritional medicine on a level that never failed to amaze me and inspire me. Those were the most fulfilling clinical years of my entire medical career, as you and I have both witnessed over the decades. When you get people on a whole food, plant-based diet, it is remarkable the changes that we witness. The diseases, these fearsome diseases, obesity, diabetes, clogged arteries. Boy, you get these folks on a nice, healthy, plant-based diet, and within days, the obesity starts to melt away, and the arteries open up, and the high blood pressure comes down, and the joints stop hurting, and the insulin receptors clear out, and the diabetes goes away, the asthmatic lungs stop wheezing so much, the migraine headaches go away, and they turn into normal, healthy people right before your eyes. It's the most gratifying kind of medicine. So for those 8 years, I practiced at True North, as I said, as nutritional medicine done right. And it certainly shaped me and inspired me as a clinician. And I still, every week, I get on Skype and I do rounds with the interns at True North. We discuss cases of patients they have in, and I want to keep that nutritional medicine flame going with them. So those are the best 8 years clinically of my career. But as you mentioned, I'm sure we'll get to I've moved on to yet another chapter to help amplify that work. But good work at True North.
Your life. What a productive person you have been in your life. Okay, so you were involved for 8 years.
So it's all breaking up.
Well, let's see if I get the message across. You were involved for 8 years at True North in a clinic that is known more for fasting than for feeding, even though feeding is a huge part of it. Can you tell us a little bit about the fasting part of your practice? Did you really think it was important? Was it just the food, or is there something special about going on a water fast? Can you kind of let because you're a man who has experiences you bring from so many different arenas. And can you kind of put water fasting in this whole mixture of going from the killing American diet to a healthy, low-fat vegan diet that both of us preach? How's fasting? Is that necessary? Do you like it? Were you impressed?
As you're implying, certainly, well, physicians get no training in nutrition, let alone water fasting. And so it was a totally alien subject to me. As I joined staff at True North, and walked right into an institution where water fasting is part of their therapeutic program for many people. Not everyone water fasts there. Talk about an undiscovered jewel of medical therapy. When you think about it, probably 1 million years ago on the African savannas, our ancient foraging ancestors probably ran into stretches of 4, 5, 6 days before they found the next berry bush with fruit on it. And they had to do these enforced water fasts because there was nothing to eat. And the body adapts to that. And I think we still have that ancient mechanism within us. By day 2 of just drinking water only, the body burns through the blood sugar and stored sugar on the body and starts burning stored fat tissue. And that sends off chemical signals that moves the body into a state of conservation reactions like inflammation. And during a water fast, the body turns off inflammatory reactions. And we see this in our patient Kay. And that's such an important question. And when everyone hears this, going 7 days with no food, are you crazy? I get upset when I miss lunch. How can you even consider that? And most people, it's beyond their comprehension. But there's a couple of basic things. One, the fasting itself is not that hard. By day 3, you're not hungry anymore. Hunger disappears. And people usually feel a great burst of energy. By day 3, they feel light and energetic. It's counterintuitive. You think you're going to be tired and weak and hungry and whimpering on the bed. And the truth is the opposite. By day 3, after 48, 72 hours, you're not hungry. People usually are alert and bright. They're feeling good. Their aches and pains are receding. It's really a remarkable state of healing. It's very, very useful. And we can talk more about some of the specifics. But behind your question is the more important issue, that as dramatic as the water fasting can be for improvement of conditions, it's a temporary state. The most important thing is what you eat after the fast. It's the food stream. It's the food, it's the food, it's the food pouring through your system day after day, week after week, month after month. That's what creates a lean, healthy body. It's not 5 days on water or 7 days on water. The water fast, it's just a jump start to get that body into healing gear, and it's a useful tool for many people. But again, it's not the fasting. It's what you eat after the fast. It's the whole food plant-based diet. That's where the real magic is. And so when the person's on the water fast, we take them to cooking classes. We show them videos. We tell them how to make this whole food plant-based diet happen at home. That's the most important part of the program.
Right. And of course, as I see it, I send people to Dr. Goldhamer for a water fast under 2 circumstances. One, they won't listen to me. And after 7 days of water, as my dad used to say, bread tastes like a steak and water tastes like wine. So it's a heck of a way to change for those who are resistant to dietary change. And then once in a while, I get into trouble with patients who don't seem to respond to everything we try and do. And I hope that going on a water fast with Dr. Goldhamer for a while will figure out what I'm missing. I have to be, blunt about it. It's very seldom that I've sent people over for a water fast where they got a recovery that they didn't get at our clinic. So, it's an attempt. It's a last-ditch effort. There have been a few people who it's made all the difference in the world. But, as you say, it's the food. You got to get them eating right.
In today's Western society, we eat all day, basically. It's as a kind of a nonstop eat-a-thon, and from the moment we get up to when we go to bed. And that's not really a healthy way to run your eating day. And during a water fast, we give our body a break from that constant state of digesting our food. And during that time, it switches into a state of repair. Inflammation subsides. Even some cancer growth turns off. We've had lymphomas melt away at the clinic. There's certainly reports in the literature of breast cancer stopping their growth, prostate cancers. the entire body changes metabolic gears. The blood chemistry is different, the urine chemistry is different, saliva chemistry is different, tear chemistry is different. Everything changes on a fast, and it's a kind of a biochemical break from digesting your food. But someone mentioned it's like taking your cells to a car wash, and just day after day you're running fresh water through your cells and getting rid of so many of the aldehydes and lipofuscins and toxins that build up in our cells. And so between the respite from having to deal with more foodborne toxins and cleaning out the molecules that are already in our cells, boy, after 5 days on water, people feel brighter and cleaner on the inside, because they really are. And usually their numbers, their inflammatory markers are down, their cholesterol's down, their blood pressure's down, their blood sugar is not elevated. It's a wonderful biochemical reset. And it's a safe thing for most people to do even once a month at home. And so it's always a safe thing to take a break from your eating and spend a day or 2 or 3 on water once a month, and changes your perspective on food as well, that, I can go 3 days without having to keep putting stuff in my mouth. And so it's a liberating, empowering thing to do, and your body generally works much better afterwards. So I'm all for this so-called intermittent fasting once a month. Do a few days on water. It gives your body a break from the constant food digestion.
Well, I would guess you just overlooked mentioning that people can get into trouble, particularly if they're on a large amount of medication, if they go on a fast without some kind of supervision or direction from an experienced person. So would you not add some caution there?
I just want to point out that everyone can do a couple days, 3 days on water. Any more than 5 days, you really ought to be at an institution like True North, where there are medically trained people watching over you who know when it's time to end the fast. But a few days of water, people can do at home. But these institutions like True North are very important for these longer medically supervised fasts that can really get a hold of some of these serious diseases.
Really, after all your years of clinical practice, after all your years and positive experiences at True North, one day, all of a sudden, you were gone. And I couldn't believe it, particularly since you seem to have such a happy home there. Can you tell us what happened to you was it about a year ago, and what you're up to now, and why you decided to do this? And, and if there are any methods of supporting an unemployed Dr. Michael Klaper, which I have to qualify that unemployed statement. But you quit a comfortable life, Michael, to go out and do some different things. And would you tell our audience about that?
Thank you for asking, John, because it's really the most important chapter of my medical career unfolding now. As much as I savored every one of those 8 years at True North, I realized I'm getting to the end of my career. I turned 71, oh my. And as much as I enjoy seeing clinically challenged patients in the clinic one at a time, at the end of the day, I would have seen 6 people, 8 people. And the task at hand is much bigger than that. And I realize, as much as I love our beloved profession of medicine, there is this massive chasm of ignorance when it comes to the role of our patients' diet in the diseases that they bring to us to treat. Modern medical education totally ignores our patients' food as the main reason why they're sitting in front of us, obese and diabetic and hypertensive and clogged up. It's the food, as you and I both know. And yet, ask any gastroenterologist, rheumatologist, cardiologist, do you ask what your patients are eating? Do you tell them what to eat? Nah, I don't know anything about it. Doesn't matter. Never been any studies show that it makes any difference. The amount of it's almost a willful denial, I don't want to know anything about it. It's embarrassing for our profession. It's appalling. Not only as scientists to ignore this fundamental truth that's why your patient is sitting in front of you with these diseases from that constant stream of burgers and pizzas and buffalo wings they're putting through their system every day. But more importantly, doctor, if you get these folks on a whole food plant-based diet, these diseases go away. These are reversible diseases, reversible, the hypertension. And no one's telling the young medical students this truth. I wish 50 years ago, when I was a freshman medical student, somebody had told me this, that these are reversible diseases and a whole food plant-based diet is the key to really curing these diseases. That would have changed every diagnosis I made, would change every treatment plan I made. And I realized that's where I need to be putting my energy. I need to go to the medical schools and give those young students the lecture that I didn't get, and turn on the plant-based light and tell them, you want to heal these people or don't you? You want to heal your patients, then get real about what they're eating and send them to a plant-based dietitian, let her do the counseling, get them on a whole food plant-based diet and see them back in a month and see if they're not better. And so at this point, that's why I left True North. I established our initiative called Moving Medicine Forward. And if people go to my website, drklapper.com, DOCTORKLAPER.com, and you click on Moving Medicine Forward, you'll see our webpage describing it. And I'm going to the nation's medical schools. I've been at the University of Michigan, been at the University of Florida, Gainesville, University of Washington, Seattle, McGill up in Montreal. I've been going to the medical schools, and the students are very open to this message. And if people want to help, they certainly can help, because those plane tickets are expensive. But more importantly, in the bottom right-hand corner, there's a little blue panel that says, if you know a medical student at a medical school, or you know someone on the faculty of a medical school, click here, give us their contact information. We'll get in touch with them and see if they want Dr. Klapper to come and give a lecture at their school. But very importantly, I want them to start a nutrition interest group and meet once a month, talk about nutrition-based cases, talk about these in their clinical rotations, and work with the curriculum committee at their schools to get this taught in all 4 years of medical education. I shouldn't have to be doing this. This should be part of standard medical education. And it's time. The public is demanding it. There are physicians waking up around the world demanding this. And so I'm trying to be that catalyst to get those gears moving, where nutrition is finally given the recognition it deserves, because we're all treating nutrition-based diseases. And as I said, it's embarrassing for our profession. You know, we can identify a genetic mismatch on gene A21 on chromosome 14. Boy, we can zero right in on that. But the thought that cheeseburgers and pizzas might be clogging up our patients' arteries, this is too abstruse for us to comprehend. And that's not right. And the doctors need to get themselves healthy, and they need to start sharing this information with their patients, because otherwise they just watch their patients getting fatter and sicker, and they get discouraged. That's right, doctor. If you don't talk to them about their diet, that's just what you're going to watch. But you get them on a healthy diet, and you get to see the most wonderful transformations in medicine. So to ask how I'm doing this, because the administration of the medical schools, they don't want to hear from me, because it's a disruptive message. But the reality is that in every medical school class now, first, second, third, fourth year classes, in all the classes, there's 20, 30, 40 students. They've seen movies like Forks Over Knives. They've seen What the Health, films that you were in. And the light is on already. They get that this is important. And to have a senior physician come to them and tell them, you're not crazy, this is exactly where your medical career should be going, no matter what specialty you go into. They welcome this message. So that's the students. I go right to the students, and they invite me in. They arrange the lecture hall. They put up the notices on the bulletin board. They get this samosas from the local Indian restaurant for the lunchtime meeting. And we've been getting about 100, 150 attendees at every meeting. We either do midday grand rounds, or we do an evening presentation. And we've been getting medical students, nursing students, pharmacy, dentistry students, surgical residents, professors. And nobody puts up resistance. You know, he's right. And they're mostly excited about the message of hope and excitement back into medicine again. So this is where I want to go with my medical career. I think my whole medical career has been focused to this point. All the years in clinic, all the thousands of patients I've seen, It's to let me get in front of the audience of these young students with an air of a ring of authority in my voice, saying it's the food your patients are eating. Before you order another $1,000 scan and another $500 set of blood tests, ask your patients what they ate yesterday. And if it's all full of fast foods and burgers, that's where to start. And get real with your patients, and medicine will become fun again. So that's why I left True North, is to devote full time to this mission. Will we change the world? I hope so. Every doctor takes care of several thousand patients, and if I can change 500 or 1,000, 1,500 physicians, we can start changing society. So it's time to work in that arena. So that's why I left True North, and I'm enjoying it. Not making a lot of money, but that's okay. Right now, it's a matter of getting this word out and waking those young students up, and it's the most gratifying work that I've done so far.
Well, money is an issue, Michael. Have you set up a foundation so that people can contribute, or is there any other way that people could contribute to your efforts? Because, I applaud you for doing what you're doing. I wish I could. I can't. I couldn't do the traveling. I wouldn't enjoy the traveling. I'm a little surprised you haven't talked about some contesting from our colleagues. I remember during my travels to try and educate the medical communities, there was always some expert, some of the, of course, the most respected doctor in the community who needed to preserve his or her reputation and always had a negative comment. But you're not getting that. How we could get some funds into the Michael Klaper efforts to change the world.
Oh, how can people help me? Oh, thank you.
Yeah, that's
again, we've established the nice folks at Dr. Colin Campbell's son, Nelson Campbell, has an organization called Plant Pure Communities. And we've entered an agreement with them where people who want to support our work at moving medicine forward can get a 501c3 tax deductible donation going to us. If they go to the website and they click on make a donation, they'll take you to the Plant Pure Nation website, and through them you can send us some financial support, and you'll get a tax deductible donation for that. So again, go to my website, drklaper.com, and it's all spelled out, DOCTORKLAPER.com, and click on Moving Medicine Forward, and you'll see that page. And if you want to help, you can click on Make a Donation, but you can also click on Tell us where there are medical students that you'd like us to get in touch with. So that's how people can help, is support us on my travels, because again, plane tickets are expensive. But also let us know if you know anyone in a medical school that would like to hear more about this message. So thank you for asking about that.
Oh, well, I think it's very important, Michael. I certainly, as I say, I applaud your work and what you've sacrificed in terms of comfort to go on the road and to try and change from the top down, which from the bottom up hasn't worked so well. Some people are very optimistic, saying that more and more people are vegetarian and vegan. It's just gone too slow. And so, starting from the top, in other words, the people who are in a position to give patients the advice they're looking for. How do I get well? How do I get off these drugs? Is an effort that you're making, and you alone. I don't know if anybody else is making this effort. Any other experiences you want to share with us over the next couple of minutes that you've been having, and any hopes you have for the future, calls for action from the audience, anything?
Indeed. John and I both share a deep, deep concern about the state of our beloved planet and the children's future who are going to depend on the state of this planet. And it's turning out that our voracious appetite for animal flesh, all the meat and dairy that we've been harnessing the Earth's resources to produce, are devastating the natural systems upon which we depend. All the major environmental destructive forces, deforestation, water pollution, water depletion, soil erosion, all of them are driven by our production of industrial scale production of meat. And the greenhouse gases that are being generated that are warming the planet, most of them are coming from again, meat production. Every year on this planet, we raise and slaughter 80 billion with the B animals. Every one of them is breathing out carbon dioxide. Everyone's belching out methane. Everyone is eating grains made with ammonia fertilizers that are putting nitric oxide into the air. That's why the forests are being cut down. This is majorly contributing to our rapidly warming planet. And the one thing everyone could do, the most effective thing by far, if you want a livable planet for your children, for yourself, is we have to see that the era of meat eating is done. We've used fishing up, we've used hunting up, we've used meat eating up. It's time to turn that page. We are being asked as individuals, if you want clean arteries and no diabetes, to evolve your diet to a plant-based diet. And if you want to help heal this planet, you want to take carbon dioxide out of the air, you want to let the forests come back, the waters purify, it's time as a species that we evolve to become truly plant-based eaters, as our digestive systems are designed to. So if there's one thing you can do is go to Dr. McDougall's website, learn about plant-based nutrition. If you've got specific medical problems, go to his newsletter page. It's an education in itself. But evolve yourself to a plant-based diet, and everything will get better. Your body will get better, the planet will get better, the animals will get better, your children's futures will get better. So, and this is a whole food plant-based diet. You can't do this on granola bars and energy drinks. You've got to really eat the salads and eat the soups and eat the veggies. And if you do that, everything will get better. So that's the message I'm delivering to the medical students and to my patients and to everyone who shared this webinar. And I'm very grateful to Dr. McDougall for being a friend all these years, for being a mentor of mine all these years, and to be an ally to root me on in my work. And so I'm very grateful to him and Gustavo for everyone who helped arrange today's webinar as well. I hope you were able to hear what we said.
Well, Michael, the same to you. Not only you've been a colleague, but you've been a friend, and we've been marching the same path for, well, since that evening we met at the North American Vegetarian Society when I heard the sad news about your dad. And of course, I went through a similar experience with my dad. But, we've earned the right to talk to people, not only because our personal health, our family's health, our community's health, our patients, and the fortune that Dr. Michael Klaper and I have had of learning the truth. Again, if you want to contribute to Michael Klaper's efforts, you can go to his website, which is Dr. Klaper, spelled DOCTOR, KLAPER, drklaper.com. And there you're able to make recommendations for places for him to speak, as well as there's a website that will transfer you to a 501c3 tax-deductible foundation so you can help him travel a little bit further to spread this very important message to people all around the world. Michael, you've done a great job. I need to hear from you more often, though. I need to hear how you're doing. I am so excited about what you've decided to give up and to take on as a new life. An enjoyable webinar, certainly for me. I hope some of the technological problems weren't too overwhelming for you. We work as hard as we can to get this right. Thank you both very much, and we'll talk to you in a couple of weeks. I'm Dr. John McDougall at drmcdougall.com. Thank you again.
Thank you, Dr. McDougall. All right. Goodbye, everyone.
Bye-bye.